Okay, it's Dr. Buford. We're getting started on the right knee. We're looking in the medial compartment. That device you see spinning around is our shaver. It has suction attached to it. And we can use that suction to help flush out the joint. It also shows us if there's any unstable tissue, whether it's cartilage like at the top of the screen or meniscus like in the middle of the screen here. So this is your meniscal tear. I'm going to adjust your knee here. This is the posterior horn of the meniscus. So to see that stuff that is very loose, that's not repairable. So that part we can remove pretty quickly with our shaver. Basically anything that comes to the shaver like that is not great tissue and usually won't even hold a stitch. And same thing here, we're looking kind of at an inner edge tear. You can see how this is the innermost edge of this meniscus so far. We'll keep working here and show you some more in a little bit. Pause. Okay, we're just taking a look here. I want to see if there's any deeper tears. We can see this inner edge tear. We're going to continue fixing that, but we're just trying to take a look right now to see if there's anything deeper that might be repairable. We've got this split here. That's almost all the way through there. See that? And so I think we're going to, one option would be to put a stitch across that, one here, the other here. We'll probably get to work on doing that in a minute. Hold tight on this thing with your right hand. Don't let me move you. Yeah, there you go. Okay, so now we've got our super ball in position. We're going to deploy it. And then we're going to back it out. And just move over on the other side of that horizontal tear. We'll get this done, show you some more in just a minute. Okay, so we're done with the repair part. You can see the horizontal stitch going across that split. That looks pretty good. As we back up, that meniscus all the way around to the back now looks better to me. That's where we're going to put the PRP at the very end, but right now we're going to look at the rest of the knee. Here's the anterior cruciate ligament. We know that's fine. We've tested it. Next, we'll take a look at the lateral compartment here. And other than some loose pieces which we can get out with our shaver, it looks pretty good. So we'll get all these loose pieces out, show you some more in a minute. Okay, so things are looking pretty good now. Again, the inner edge of this lateral meniscus, a little bit frayed, but nothing too horrible. And we're just basically flushing a bunch of salt water through the knee. So that looks good. We're going to look at the patellofemoral joint next. Okay, so here's a little defect in the trochlea. See right here? And that's one of the reasons why we're doing our PRP injection, to try and stabilize these areas. The patella up above has some softening of the cartilage as well. And then here's a central area in the trochlea that is a little bit thin also. This is over on the lateral side here. I think we are just about done. The last thing I'll show you will be the PRP injection. Okay. Okay, I just wanted to show you how we're placing the PRP. You can see we're, with a little bit of luck, going to go into the menisco-capsular junction kind of behind where the tear is. There's the tear. And we're going to place enough PRP here just to create a healing response, and the rest of it will go into the joint. But now I'm back there with my 22 gauge. Again, you can see how we are there. I'm going to turn off the water. Actually, right now I don't really need to turn off the water because we're going to be going into the tissue. Hold the scope there. It's fine. It's fine. Hold the scope. Hold the scope. And so I'll tell you when we're injecting. We're going to start injecting right now. So I've put in about 2 cc's there. That is about 3 cc's are in. There's 4. And then the last 3 cc's I'm going to place into the joint. To do that, I'm going to turn off the water. And I'm going to drain all the water out of the joint. That's what you see happening now. We'll get this pretty dry. And then we'll put the last bit into the joint itself. So this will be the end of the video, okay? Good luck to you now. Bye-bye.